Johannes was.
Hello and good morning, or good noon, wherever you are. People are coming slowly in. If you wanted to attend the IANPHI Regional Europe seminar, Shaping European Health Policies, Strengthening the Role of National Public Health Institutes in Transnational Challenges, you're right here. Ivo, good to see you.
Hello, good to see you. Thank
Hi,
you.
and Milena. Good to see colleagues coming in. We're just waiting a bit until people can enter. Marie from the IANPHI Secretariat is kindly helping us and facilitating the session and letting people in. So, Ralph, perhaps you can share the first slide, the starting slide from us, so that people see the title and know they're in the right seminar. Perhaps it's like in my calendar where we have 3 meetings in parallel ongoing. So you're here in IANPHI's seminar, Shaping European Health Policies, Strengthening NPH Role in Transnational Challenges. Ralph, I see the referencing mode, so please can you change it so you only share the slide we need to see? Thank you. We have really a tight agenda today, so I will just wait another minute until people are coming.
In any case, I am recording the session so that we can do a transcription or an article or something afterwards. So if we have to go ahead, we have to go ahead so we can squeeze everything in because there is a lot to cover today. So if you have to go ahead, no worries.
Oh, I get messages from people that the Zoom is not working yet.
That's strange because I'm letting people in. Are they connected to the right link? And do you know who?
There should only be one link, hopefully.
Yeah.
Otherwise, I'm a bit
I'm
running out of ideas.
yeah. Let me see, but yeah.
I'm check. Yes. Okay. Still, I think we cannot change it anymore now.
But you have access, you can see the participants, so you can see if they are coming in. Some of the people who had messaged you that the Zoom wasn't open yet, because I'm looking at the invite and there is just one link, so that's strange.
Okay, I can't still we start now. I think we are welcoming you to our webinar organized by the IANPHI Network, which is the Association of International National Public Health Institutions. My name is Claudia Habel. I'm chair of the European Regional Network, and we are pleased to give a session today on the current EU for Health program and how it's intended to provide a better understanding of how the public health institutions hopefully can work together more efficiently. And of course, also with public health partners, understood people of ASFER will be coming. And we try to liaise more efficiently with the implementation of the public health program. You might know that the public health program is currently debated in the light of the upcoming multi-annual framework contract that will be, so the budget of EU will go, how much will go into health as of 28 for the next 7 years. And health is a bit under pressure, can we say it. And for us as public health institutions, I think we have to work together now to see where we can work together content-wise, but also how we can really make sure that money for public health, also from European end, is available besides the national resources. I'm really pleased to have this webinar today, and can I ask for the next slide for the agenda, please? It's I would like to ask my colleague Ralph Chan. He's from the Austrian National Focal EU for Health Focal Point and working at the Austrian Public Health Institute. He will tell you what the EU for Health program can do for you, and there will be a chance to indicate in a list. We will post where you're interested in which topics. Secondly, there will be a presentation by Hanna Tolonen. She is a research director from the Finnish Public Health Institute, THL. She has a very long-standing experience working in and for EU projects, currently being work package lead in 2 major joint actions in the field of public health. Then we will have a moderated discussion of all of you. You have your chance to ask questions, to raise topics of interest. We will have perhaps a look at the list together where we can tell is there a couple of countries interested? Perhaps some of you would need support to get nominated because the deadlines are approaching. And then we will do a final round by the end. And Marie was kind to offer that we will send out this list afterwards so you can still indicate something. Okay. Good. Then I hope that's it. And we can now start with the actual presentation of Ralph, and people are still coming in, I hope.
Thank you very much, Claudia, for the introductory words. I would like to introduce myself as well. My name is Ralph Chan, and this presentation today shall highlight that public health is essential for our collective well-being. It protects lives, promotes equity, and strengthens our communities. The EU for Health funding program plays a vital role by supporting stronger health systems, better disease prevention, and improved access to care across Europe to build a healthier, more resilient future. In my presentation today, I would like to introduce to you what EU for Health funding program and its current annual work program can do for you. The presentation is divided into 3 points. The first point is that I will give you an overview and an introduction of the program itself. Then there will be a list. Hopefully you can find the link in the chat. And if you wish, please indicate your potential non-binding interest for the upcoming calls in this table that I've just mentioned. Otherwise, Marie, as mentioned, will send you also the table again. And then I will also emphasize and would like to highlight the role of national focal points in the EU for Health funding program. So let me start by introducing to you what is EU for Health. EU for Health is a funding program with a vision for a healthier European Union. It sends a strong signal that public health is a top priority for Europe and is based on a response to the COVID crisis and serves as a key driver in building a European health union. The budget under the current multi-annual financial framework is around 4.6 billion. And we can see that there are 4 key objectives that EU for Health has. The first one is improve and foster health in the European Union. What do we understand under this objective? It's the reduction of the burden of communicable and non-communicable diseases by supporting health promotion and disease prevention, reducing health inequalities, fostering healthy lifestyles, promoting access to healthcare. The second objective is protect people in the European Union from serious cross-border threats to health and strengthening the responsiveness of health systems and coordination among the member states in order to cope with serious cross-border threats to health. The third one is improvement of the availability, accessibility, and affordability of medicinal products and medical devices and crisis-relevant products in the Union. And the fourth objective is strengthen the national health system by improving their resilience and resource efficiency through supporting integrated and coordinated work between member states. The annual work program, as you can see here, consists of 5 strands. So basically, if you want a particular objectives. The first one is crisis preparedness. What do we understand, or what does the EU for Health understand under crisis preparedness? It is protecting their citizens from serious cross-border health threats, strengthening health system response, and as I mentioned before, also enhancing the coordination among member states to cope with serious cross-border threats to health. The second strand is health promotion and disease prevention, meaning improvement and foster health in the Union, reduce the burden of communicable and non-communicable diseases, support health promotion and disease prevention, reduce health inequalities, and foster healthy lifestyles. The third strand would be health systems and health workforce. Healthcare workforce means the improved availability, accessibility, and affordability of medicinal products, medical devices, support their innovation, strengthen resilience and sustainability of health system, and reinforce healthcare workforce. The fourth one is digital transformation. This means to advance digital transformation of health systems, strengthen primary and secondary use of health data. And we have also an overall or overarching strand, as you can see here, and the golden one, cancer and the new priorities 2025 to 2029 on cardiovascular and non-communicable diseases. You can find more information about the funding program EU for Health and its details in the EU for Health annual work program under this link. The slides will be also shared with you later on, so you can just click on the link afterwards. And more importantly, there is also so-called the current calls, which you can find indicated in the second link here on the slides, where you can find in the tentative calendar, the deadlines for each of the calls that are currently published. So what is indicated in the annual work program 2025? You can find in these calls the description of the actions with the policy context, the objectives, the scope, the activities, the expected results and impacts that should be in your project, or what the European Union expects you to work. There is also information about the procedure type. So is it a grant? Is it a procurement or price? So under grants, the European Union understands that this is a direct financial contribution from the European Union budget awarded to beneficiaries in activities that serve Union policies. There is also procurements these are contracts with economic operators to purchase services or goods on account of the Commission, either through open tendering procedures or the use of existing framework contracts, which were established following a competitive procedure. Then 2 other types are also prices and others. You can also find in this documents an indicative timetable, and indicative budget allocation, and details for funds applications, so targeted applicants. We will focus on joint actions later on. This is also part of the grants. As you can find here on this slides, is the budget and the strands that I've just mentioned before, just for the overview. So let me now focus on joint actions in EU for Health. So what is joint action? It can be quite interesting for the participants in this webinar today, because joint actions are a form of direct grants to member states' authorities in which project is aimed to be executed by a consortium spanning across all countries, interested countries for EU for Health. Please look in the work program if your country is also eligible. So that's important. So who is eligible as written here? So it's each state participating in the EU for Health program, meaning respective their Ministry of Health. They must be nominated, they must nominate one or more competent authorities plus affiliated entities. Yes, and also third parties, of course, are eligible for this funding. So where can you find it? As mentioned before, in the annual work program, and as well as on the tentative calendar where you can find the timeline. Here you can see how the next steps. So we already have received an invitation, so as member states at the moment, and we're currently in the nomination process. There is a deadline in October, coming up in October. So if you are interested, please contact your respective competent authority or ministry in this sense. So there will be a hands-on workshop. Sorry. Oh, okay. Afterwards, there will be a hands-on workshop where you will also find, you get more information on how to draft the proposal. And afterwards, the proposal will be submitted and evaluated by the European Commission. And if it is evaluated positively, negotiations towards the grant agreement and signature will happen. So the start of the project will also happen. Oh, sorry. So let me just give you an overview of the 2025 joint actions. So the invitation, as mentioned before, was sent in July 2025. The nomination deadline this year is only single wave, so it will only be on October 16, 2025. However, there is a submission deadline between October 16, 2025 to 12th of February, 2026. We have different calls here, as you can see, as indicated here. The list that we share should, you can find there also a column where you can please indicate your interest, as mentioned before, and we will also try to connect you with the people and the national focal points that can also help you with the application. Okay, and now I would like to also, if you don't know yet, also introduce to you the role of national focal points in EU for Health. So national focal points are basically national experts of the EU for Health program that was established by the third program of the Union's action in the field of health. There is a long list of national focal points in EU countries and its participating countries, though those are appointed by the respective national health ministries. What are our tasks? I'm also part of it as the Austrian National Focal Point. First of all, we are here to inform and raise awareness about what the EU for Health can provide you. So we're for the dissemination of information and details for organizing promotional events such as info days. We're here to support you as potential applicants to understand the scope of the EU for Health. We're also providing trainings on different aspects, such as financial aspects or finding partner organizations. And we are also a hands-on supporter. We give you hands-on support as beneficiaries. And The network of NFPs is part of the joint action, NFP for Health. There is a second one also coming up now that works together to increase the capacity that we currently have. And you can find here a functional mailbox if you are interested to contact the Austrian National Focal Point, as well as our website as an example. We also provide a newsletter, unfortunately only in German, most of the information, but if you are interested, you can get to us. Lastly, how can you get support from the national focal points is please just write us. We have a list of different activities coming up and have already been doing in the past few years, from individual support to collective trainings to also joint events with other funding programs. So we will also help and use our networks in finding synergies with other health related funds and programs, for example. So I just want to end here with telling you, please, if you are interested in applying, contact your NFPs in your respective countries. They will help you, support you, and hopefully you will submit a successful application in the EU for Health funding program. Thank you very much.
Thank you, dear Ralph, for giving us really a very concise rundown of the upcoming health program. So the current one with the deadline, as I said, 16th of October. We made this webinar also today because we fully understand that some administrations take a while to go through this proper nomination procedures. So in many countries, it's about 1 week for the formalities. So if you're interested and you put it into the document, we can also reach out to you afterwards and help you to identify the correct nominating person if necessary for the public health institutes. For those of you who are from competent authorities like ministries, I think you know your procedures well. With that, I'm really pleased, and we have a discussion afterwards, so please save your questions for later. I'll hand over to you, dear Hannah, and please also say a few words on yourself, and Ralph will share your slides.
Thank you, Claudia. So as Claudia introduced me already earlier, I'm Hanna Tolonen, the Research Director at the Finnish Institute for Health and Welfare. My history with the public health programs goes all the way back to early 2000, when the first public health program was launched, 2003. And since then, I've been involved in the joint actions in every single one, either as a joint action coordinator, work package leader, partner, whatever role you can have. I had tested every single one of them over the years. And as said, currently I'm leading the work package in 2 of the largest joint actions ever launched, Chagadi on the cardiovascular disease and diabetes risk factors, and the Prevent NCD, which is focusing on cancer and other NCDs. So based on this background, Claudia asked me to provide some reflections on cross-country cooperation and implementation of the actions, how we can benefit doing jointly the public health actions through the joint actions. Next one, please. So as we all know, the health challenges are not respecting our borders. They are getting cross-border, did we want or not. And good example was COVID. We were in many countries trying to close the borders to stop the COVID spreading, but that didn't help. So diseases are going cross borders, as well as the determinants of these diseases. Tobacco is moving cross borders, alcohol, diet. These days, also the social media and wide use of internet is making it really difficult to limit something within one country. We are spreading the information, trends, brands to all over the world. So the challenges on health are our common challenges, and that's why we need to tackle them together. And for that, EU for Health and joint actions are an excellent tool, because they allow us as national actors, public health institutes especially, to jointly do the activities, see what's working in one country, how we could implement it in the other one. Next one, please. So we often identify good practices in one country, what's working, for example, for the tobacco legislation or the tobacco cessation activities. But transferring the same model to other countries EU-wide may be quite complex because systems within the countries, contexts, capacities, infrastructures, those vary. And that makes it difficult to make one fits for all solutions. And therefore, next one, please. We often face the challenges that national health systems differ in structure and resources. So we just cannot take what's working in one country and putting it as it is to our own country. There are the policy priorities which not always align. And good example on that is the snus. Sweden is quite liberal on that. In Finland, we would like to make that more or less illegal as it is. You cannot buy it in Finland, but the border is open, so it goes across the border, and snus is quite a big problem in Finland as well as the nicotine pouches. So policies between the countries make it often occasionally difficult to find the common ground for the actions countries are taking. Obviously, there is the administrative reporting burdens in many of the actions, and that may slow down the take-up in one country, but if we do it jointly, we can learn from each other to way to do it and make it perhaps a little bit less burdensome. But when we are thinking EU-wide implementation, for example, through joint actions, a lot of good activities have been implemented with the joint actions. But unfortunately, when resources of joint actions are used, and it should be transferred to the national resources to carry on those, there comes the limitation. Do the national resources be available for that implementation can be carried on and followed up after the project ends? So that's quite often the big challenge, that good intentions we have started in the projects end when the funding ends as well. Next one, please. But anyway, when we're doing the scaling up of the practices from one country to the other, we have to keep in mind that adaptation is the key. But when we are doing the adjustments with the models, we always have to at the same time think that what is the key of that activity that country X did and it worked, that we need to remain, and then see what are the borderline activities which we perhaps need to adapt to make it feasible in our country. And that might be cultural issues, especially diet is one of those where we have a lot of cultural issues, even within the Europe, which we have to remember. We are not that similar in European countries in that respect. And adjusting those for the population to which we are implementing the good practice is really important. Next one, please. But in general, based on my long experience, I would say that joint action deliverables, what's developed and implemented there, they are really valuable and can be used to improve the health of the population in Europe jointly, as the name says, learning by doing, learning from others. So that's why I see the added value on joint actions based on the other projects we are running in the Europe. Thank you.
Thank you so much, dear Hannah, for giving us an overview on how joint actions could really help in implementing public health practices in Europe. And I really agree with you. The nicotine pouches are a growing threat. We have already doing some analysis on in our institution. It's also the Poison Control Center for Austria. And there's a growing of number of especially small children who have poisoning caused by these pouches. And we are not the only country we see, but we're just trying to reach out to others to see how big the problem is really, you know.
We are facing the same problem in Finland, actually.
Yeah, so this is a very good point of this cooperation that's needed between the public health institutions in Europe. And now, as I promised, we'll come to an overview of who is interested in what. I understand the list didn't work as I planned, that everybody can enter online on the spot, but please take the chance and indicate and write to Ralph if you're interested, so that you don't miss out the deadlines as I mentioned. I see also that colleagues from Moldova have joined us. I talked to Rado yesterday, so perfect that you could come. I want to just ask a few. Perhaps, Ralph, you can share the list that you showed on the joint actions before again, and we just could indicate, I think, the most important ones from a public health institution perspective. It could be the one, I would say, support lifelong prevention for a healthy life, including through screening with a focus on cardiovascular diseases. This could be of interest, which is number the IB802, the Joint Action 2. Yeah, I think it's on the next page even, but now here it's on the, no, go back. So it's the fourth bullet here. It could be interesting. Also, the One Health approach for cross-border pathogens could be of interest for some of us. I think you see already from the figures here, Hannah mentioned that the other joint actions were the biggest ever launched. I'm sure, I think it was a one-time event. We are now back more to, let's say, regular joint action sizes. We also have smaller ones, like the one for the EU4Health program that is starting with 1.5 million. But I'm honest with you, to involve more than 30 countries and have 1.5 million, that's a challenge. So I think this is a reasonable sizes where you can do something. Another one that could be of interest is the quality of medicines and implementation of pharmaceutical legislation. I think it's more interesting than ever, as we have, of course, the pharmaceutical package, which is now being finished. And we don't know yet of the plans of the Bio Act legislation, which is really pushed hard nowadays by the Commission. So we'll see how quick this really can be pushed through all the comitology processes and everything. So these are the 2 or 3 on these pages I mentioned, and then the next one. Also here, I'm not sure if a lot of you will be participating. In our country. It's more the Medicines Agency that of interest, but we understand fully that some of the public health institutes might also have a role here a bit. And I think of really big interest is the 4th bullet also here, the various direct grants we have for member states authorities to enhance the data for the upcoming European health data space. So the secondary use of data is of interest for many of us as public health institutions, because we are the ones who need to provide the data and the facts and figures needed for decision making. So I think this could be also an interesting one. But this was my perspective. So please also tell us now who is interested in what topics. If you have questions on this, the floor is now on your side. I think Marie can give the floor to people who want to raise your hands or just speak up.
Yeah, there is a button at the bottom where you can raise your hand, but if you have difficulty, you can put the question in the chat and we'll also see it, but just go ahead.
Well, I hope there will be some interest also from your end on some of these calls or joint actions. You could also type the number in the chat if you wish. Well, if not,
Do you have, you have
this.
From Ivo Rakovac has just raised his hand.
Yes, please go ahead, Ivo.
Yeah. Thank you. Thank you and hello all. Thank you very much for a very interesting webinar and for organizing this. Really very much appreciate it. I mean, in principle, we from WHO and come from the regional office for Europe, and very nice to see some familiar faces, but also some new ones. We would in principle be very interested in joining. And we are, Hannah knows this very well. We have really very good collaboration with Joint Action Prevent NCD, with Jakarta, and so on. So obviously, the joint action on prevention, especially cardiovascular diseases, would be of great interest to us, but also on the secondary use of health data, because this is of extreme importance to WHO. This is something where we could do a lot of things together. And then there are many more. I come from the NCD department and prevention and promotion. So I'll speak on more for this area. But the problem is that we are not eligible for joint actions. And this is something that I wanted to raise because I think the national focal points that are here on the call have a big role in that. And I would appreciate if the national focal points could advocate, especially in this current situation, if certain bigger share of EU for Health could go to WHO Regional Office for Europe, because we are a partner in implementing the joint actions. And thanks again, Claudia, to you, but also to THL and so on, and some other public health institutes, we have published very strong call for action to support financially the work of WHO. And EU for Health would be a mean and a vehicle for that if the national focal points raise their voice jointly. So maybe something to consider. I don't want to hijack the meeting, but regardless if we have the funding or we don't have the funding, we would be very interested in supporting those some of those activities, and we have a long-lasting collaboration, which I think we can, which I'm sure we can build on. But again, I think if the national focal points could reiterate and bring this message over and over again, that funding of WHO also for European countries is important, that would be very much appreciated. Thank you.
Thank you, dear Ivo. And I see exactly what you mean, and perhaps Hannah can also comment on that. We see the problem that the WHO and other public health partners are not per se eligible for the joint actions, but you can be involved, some of your experts at least, in their personal capacities. This is always a workaround, especially in the current situation. Hannah and me are currently in the Health Forum Gastein in Austria. Some of you will know it. And Natasha was here already today telling us about the dire situation at WHO, that really she talked about a reduction in staff and health workforce by 1/3, which is tremendous, I would say. It's now the time to stand together for public health in Europe. It's now the time to advocate and, to use all channels in health diplomacy that we can have at hands. For the public health institutions or the focal points, they have some, we can demand that, but it's also better even that the ministries do that themselves. And we realized it's also important that not only ministries of health or social affairs do that, but rather the ministries of foreign affairs. This is what I learned in all this, who is the negotiating there. So this is, I think, for us, that we also reach out to our partners in this field, in foreign affairs, that they also are aware of the situation. Coming back to that, so I hope there is really room for cooperation. And perhaps, Hannah, you want to comment on this here also before I go to the other points?
Yeah, like Ivo said, in those two big joint actions which are ongoing, the WHO Europe collaboration is really important on those, but it's also quite tight. So we do a lot of together, but it's a pity that they are not able to get any funding for that. So we need to figure out always the ways around to fund the meetings, for example, which we are doing jointly. So that's something that hopefully in the next public health program, if we ever get one for the MMF, we can somehow solve the problem.
Yeah, and I will also refer, Ivo, there's the network for those of you who are IANPHI members here. There's the Regional European Network meeting next week in Oslo, kindly hosted by the Norwegian Public Health Association institution, sorry. And we will have a session especially talking on how we can cooperate with the public health partners. I think people from ASFER are coming, EuroHealthNet, ECDC and others. I'm not totally sure. I think there's also from WHO, there's perhaps only some video exchange, but I know also that in the wake of the European Public Health Conference in Helsinki in November, there are some talks planned also with WHO partners how to overcome the situations. And some countries like ours react that we try to, second people more than usual, to second people to to WHO offices. I know that I think Finland is doing a share on this, and also Guri of Norway told me she does that already, and so on. So, but for now we will carry on. Thanks for all who went already stated some interest in some parts. We will take a note on that and that we can work together. But what we now discussed, I think for the multi-annual framework contract, it's very important. It's now the time to reach out to our ministries as a public health institution. I see in our case, our ministry is here also, that it's very important in the current negotiations that we have to stand strong and say that we need some public health funds extra, and not only through the competitiveness funds or through the research program. And we understand health is invoked by everyone. I think now we always wanted health in all policies, and now it's the other way around, that we say we don't need our own health policy. It's everywhere, But honestly, I'm doing this job for 30 years, and I don't believe that. It's better to have your own, let's say, playground and share it with others than to have to be, relying on other playgrounds. I hope I put it in the correct manner. So this is really important, but it has also to do, of course, with the mandates we as public health institutions have. And this is something, the questions I have, is it sufficient for the current implementation? So do we have enough voice in the policy field of public health? It's not our job to be speaking alone. It's our job to advise the decision makers. It's our job to give evidence and data. But still, we need to fight that this evidence and data are not ignored. And I'm really pleased to have a debate on that, and would be interested to hear your views on that. Please don't be shy. I see Milena is here from a public health institute, for instance. So besides Hannah, of course. Hannah, please.
If I start, then others can follow me after. I think that there's a lot of difference in public health institutes between the countries. Some of us have quite a lot power, I would say, on the political debate, and we are heard. For example, in Finland, we are really active on that, and we get heard in the ministerial level. We are also doing some advocacy at the EU level. But I know that in some countries, the way from the Public Health Institute to the discussions with the ministerial level, it can be quite long and burdensome to find the ways and get the right people for the dialogue. So it's not that straightforward that all European countries are equal on that. But if we're thinking, for example, European level advocacy, then the IANPHI Europe and the Public Health Institutes there, if they organize themselves well, that would be quite a powerful tool and the group to advocate issues at the European level, for example.
Thank you, Hannah. So, does others want to come in here? I see that
Maybe I
Lisa.
could.
Yeah, please.
Sorry.
Please, Ralph.
Yes, maybe
go
I
ahead.
could just follow up also and strengthen a little bit that argument that Hannah did make. I think because this group here in this webinar is quite unique in that sense that that this is a network, and I think this network can provide, for example, some sort of or establish itself for rapid responses, as we have discussed, for example, in one of our meetings about, for example, cost reductions. How can the IANPHI network, for example, can work together through a statement, through a shared statement, how to counteract by strategic investments, or have a shared protocol or mutual aid agreements to improve cross-border resilience. And I think what is important, as you have mentioned already in the beginning, is also to speak with one voice. So it doesn't mean that the regulations have to be the same one, because it's impossible to have a unique, to have one size policy, but at least to have a same voice in how to understand societal trends and how to approach basically these political issues.
I think that's a good way forward. And also, Marie, we have to discuss it with Neil and the Secretariat, and perhaps in Oslo there is the space for that, that we really have to stand here together. As a Europe, this is more a concern for the European partners for sure, and not for the whole IANPHI. You need to know that IANPHI is, of course, a global network, and the regional networks have no, let's say, decision-making power as such. The governance is through the global organization. But of course, for our sphere, we can do like a letter together, and we did that already with, in instance, Finland and Portugal and others. When there was the first cuts regarding WHO announced, we immediately reacted and making a commentary in the Lancet stating that it's also a chance for Europe to have a greater role in the proceedings, and how to shape the health in the world and in Europe. And I think what's also very important for the global perspective of IANPHI is that there's plenty of, if you look at the program, of cooperations also with Africa and really going global. So the EU Health Program has an impact on the whole world and not only on Europe. Also thinking of the Team Europe initiative and other such matters. So this is, I think, going in a very good direction. But I would assume also when it comes to the heart again and the funds are deteriorating, Europe would again focus on the European health, And so we would lose this momentum created now with the current program to also include the whole world, and go global with the health program. Because with this if there's cuts, I think it would be concentrating of the threats Europe is faced. Yeah. But the pathogens, as we all know, don't know about borders. So it's really good invested money if we do it on a global scale and not only on European scale. Yeah, for me, I was expecting a bit more debate, if I'm honest with you. But of course, just feel free to add in here. Also, that we would like to understand a bit how can we effectively unify our voice in Europe when it comes to public health. I will also have discussions with the public health partners here in Gastein, like UFA or EuroHealth. We will carry on in the Oslo meeting also. The focal points, it's always funny for me. We have focal points in IANPHI and we have focal points in the EU for Health program. So I'll have to be specific which focal points I address. So the EU for Health focal points, as Ivo mentioned, have also a very important role as being the bridge between the ministries sometimes, or being in the ministries to the program and the committees there. So it's also important for us that we, in the upcoming joint action, in all the capacity building and a change that is planned, we will also look into this matter. So how can we better, let's say, advocate our cases. And I think also in the regional network of IANPHI for these focal points, this could be also a topic, yeah, and for the members in Europe. All right. So, is there any more questions or comments? I saw in the chat from Czech Republic and the Netherlands where they're interested. Thank you very much for telling us. And if there's others, just add on and fill in the list and send to Ralph, please. So, all right, we are a bit quicker than I thought so, but if people have spoken who wanted and the others won't, so. Well, I see also there's no raised hands, I guess. I would see them. With that, then I'm really happy that you have been here in this session, that Hannah gave a nice impact analysis is too much, but to show how we can make use of our best practices and how to scale up them in Europe, that we can do that together. Thanks, Ralph, for introducing very well into the, let's say, technicalities and the current program and the roles of the focal points. As we said, we can share this email, these presentations with you if you want. And also for Ivo, arguing your case with WHO regional office, we stand with you. Please be ensured on that. Yeah, with that, thank you very much for joining our webinar and have a very good day.
Thank you.
Bye.
Thank you.
Bye.
Bye. Thank you.
Bye.
So thank you. Oh, we don't hear you, Marie.
Yeah, sorry.
You have to
really-
run to the other session, I know.
No, they finished a bit late, so I have a bit more time, so that's good. So sorry a bit about, the issues with the document. I'm glad you managed to share it. And so I sent a message to Johannes to say, if we receive things on the secretariat, we'll tell them to reach out to you so that they
Sure.
know to contact you.
To Ralph, please, if you could direct them to Ralph immediately, it would be nice.
Yeah.
And
No.
I hope Johannes really wrote to me in the meantime that if there was some issues with the Zoom link. I really, really hope that we had no problems, because I know 2 people at least who told me this morning they will attend and they were not here. So I hope it was not
So strange.
issue. Yes, I don't know what's the problem, because I really expected a bit more people, but still I'm happy. So we had, but important ones like a regional, Ivo is the regional director for NCTs at WHO Euro. So this is of course a very important person. And at the SAS, the Germans attended, the Czech. So there was many countries, so Austria, Netherlands, and this is also a value. If it's not free from one country, but for the countries, this is what's counting for me.
That's good. So can you send me your slides? Actually, I have Hannah's, but I don't think I have the ones from the Austria NPHI.
Sure, I will send to you. And for Hannah, don't you worry, I'll ask her also for the photo credits. I'm not sure if she has an update, but she has all the rights on her photos. So she knows we'll put it on YouTube, so there will be no troubles, because you pointed that out correctly.
Yeah.
She has a free pick license and she used them, so I'll ask her explicitly. So no worries for this licensing. Yeah.
Can you CC Rafael or the secretariat when you ask Hannah?
Yeah, it's sure. Yeah, perhaps she has an update where the credit is visible. But now you can stop the recording also, I think. So you don't have to